What is schizophrenia? Who are schizophrenics? Are they mentally unstable people who live in a world of imaginary voices? What about that weird ex-colleague that cannot hold down a stable job? Are they the violent, psychopathic, split personality, incurable serial killer? Actually, not really. How much do we actually know about mental conditions? Are they just stereotypes or is there some truth to them? I'm Gurmit Singh. Join me as we debunk the myths surrounding mental conditions. In this series, actually, not really. What is commonly portrayed of schizophrenics in the media is often sensationalized. The real deal is actually not always so dramatic. Let's hear from Rina, a person with schizophrenia.
My life isn't a horror story. Even though this thriller image is often portrayed in the media, my normal routine is typically quite mundane. Even my psychotic episodes aren't really very extreme. While my thoughts are sometimes kind of messy, I'm typically quite calm.
Psychosis is where the individual's thoughts and perceptions are split from reality. Schizophrenia is one of such forms of psychosis. This condition is not that rare. It is actually the most common psychotic condition in Singapore. A third of psychotic patients have been diagnosed with schizophrenia before. There is also a spectrum of intensity in the manifestation of the condition, ranging from violent, grossly disorganized behavior to milder forms of delusions.
I tried to open up about my mental condition before. The term schizophrenia scares a lot of people because they have their own preconceived notions about it. When some of my friends learned about my condition, they quickly decided they couldn't understand it and stopped messaging me. Many dear friends have slowly left my life in this manner. While I can understand why they did so, I cannot help but feel hurt.
So, what kinds of symptoms do people with schizophrenia have?
The symptoms for me were quite mild. I used to hear voices talking in a language that sounded familiar but my brain couldn't understand. I used to hear spaceships traveling by as well, like I was communicating with outer space. I was kind of intrigued and wanted to hear more. I guess it was fun for me, but kind of scary for my family and friends who were watching. Only when I was diagnosed did I realize it was a brain disorder.
Schizophrenia is split into 4 subtypes. Paranoid schizophrenics have hallucinations and delusions of persecution, grandeur, and/or jealousy. Disorganized types show bizarre behavior, childish thinking, and disorderly motor actions and speech. Catatonic patients experience periods of statue-like immobility mixed with bits of hyperactive motor actions or speech. The undifferentiated subtype is a mix of cases which fit the bill for schizophrenia, but shifts between patterns that do not fall neatly into the other subtypes. All subtypes will still experience the main symptoms that characterize schizophrenia. These are delusions, hallucinations, disorganized speech, greatly disorganized or catatonic behaviors. 2 or more symptoms need to happen often in a 1-month period of time for an official diagnosis.
Schizophrenia was like a fantasy exploration to me. The voices called out to me and I responded. I thought those voices were my friends. It started from a strange incident when I was younger. My mother was clearing out the house when she threw away my old toys. I actually heard them calling out to me, crying for me not to abandon them. I ran back into my room and blocked my ears with my pillow. I felt so guilty for months after that. Having this condition makes it hard to be around people. I occasionally have episodes of unfocused thoughts and catatonic actions that would cause me to freeze up. And this happened without warning. People around me would react in a shocked way and give me strange looks. Sometimes it happens due to some external trigger. I know that it's not fair to fault a stranger for accidentally triggering me, but I just hope that when it does happen, there are people who would understand my condition and help me at that moment.
The cause of schizophrenia is usually an imbalance in brain neurotransmitters. Medication remains the main treatment method. Antipsychotics, also neuroleptics, can balance the chemicals and address the symptoms. It is often paired with cognitive behavioral therapy to help the patient change how they see and react to things around them, teaching them to deal with their abnormal thoughts. Schizophrenia is a commonly known disorder but not very well understood. The dramatic image hyped up by the media only further reinforces the wrong ideas about the condition. Schizophrenia is not a terminal disease. Even though mental struggles are invisible to outsiders, it is a very real and tangible daily battle for those who suffer from it. Stereotypes do nothing but to reinforce falsehoods and drive people with these conditions further into hiding.